Good morning all. So today we will be learning about some of the small topics, that is chelating agents. So what do we understand that chel refers to clog. Okay, to clog it and remove it. What we are clogging it and removing it? The heavy metals. Okay, so can you just guess when can we get this heavy metal poisoning? People working in that industry, can we get that? Yes, the people working with heavy metals, who are those? Mercury, radioactive industries. Can we get iron? Do we get by iron industries or by something else? Can we overload a person with iron? Yes. When is it possible? If you are treating the patient with anemia. Okay. Can there be iron overload in any other condition? One is anemia. You are directly giving iron to patients. Other than that, can you name one condition where we give repeated blood transfusions? Calcemia. Okay, so calcemia is the one condition where you can get this iron toxicity. So with that note, we today learn what are the chelating agents we have. Do you remember any copper deposit disease? Wilson's disease. Very good. Okay, so Wilson's disease, what are the drugs we can use there? Okay. So the factors here we need to remember. First, we'll try to understand what is this chelating agent. Okay, so chelating agents are the polar groups. Okay, chel is to clog. Okay, these are the polar groups which contain SH or OH and can bind to the metal ion as endogenous ligand binds. So the endogenous ligands or the endogenous receptors we have are the ones which will mediate the toxic reactions of these metals. So they should be able to displace the endogenous ligands or bind similar to the endogenous ligands and prevent the further exposure of the body enzymes to the metal. So endogenous ligands bind to the metal and form stable, non-toxic, water-soluble complexes. This is very important. Okay, if it is not only binding, okay, it should be non-toxic and water-soluble. Do you remember something similar, some definition in biotransformation? Conversion of biotransformation definition. We are converting polar to non-polar or non-polar to polar. So it is better to give you options and then expect answer. Okay, so what are the factors which can affect this chelation? Okay, so relative affinity of the chelator to heavy metal. Okay, that means they are better than the endogenous ligands in attracting it. Distribution of the chelator in the body, whether the drug which we give can get distributed to the parts where the toxicity is maximum. Okay, so do you remember where we see Kaiser-Fisher ring? Where we see it? Okay, so that's it. That's what I was speaking about. Capacity to mobilize the complex, half-life of the heavy metal and time of their exposure. Half-life of the metal, we are particularly speaking about the radioactive materials. Okay, so if the person is exposed for these radioactive materials for a longer duration of time, you might be knowing that there is no further treatment and patient will die or the person will die. So this was the same method which was used to kill the. So I will not explain. Okay, the person, the Russian intelligence agent was loaded with plutonium, okay, by the same Russian people who got refuge in US. Okay, so these were the methods to kill. So what happens here? Mechanism of action of heavy metals, okay, is not the mechanism of the drugs what we are using. What these heavy metals do, okay, the heavy metals combine with one or more reactive groups, okay, that is the oxygen, nitrogen, sulfur. These would be the reactive groups which are present in the normal enzymes which are present in the body. Okay, they can hamper this physiological function, enzyme inhibition, oxidative stress, cytochrome deactivation, all these things are there. So do you remember cyanide? So what do you think cause? It acts, it inhibits what? Cytochrome system. Okay, so what is the treatment? Yes? Cyanide we give amyl nitrate by inhalation, and the latest treatment is overall nitrates over in the class. We have discussed so many things. There are 4 drugs now. Sodium thiocyanate.